Alpha blockers and beta blockers are two types of postsynaptic anti-adrenergic medications that prevent the respective receptors from being stimulated by catecholamines, like norepinephrine and epinephrine. The nervous system is divided into the central nervous system, so the brain and spinal cord, and the peripheral nervous system, which includes all the nerves that connect the central nervous system to the muscles and the organs. The peripheral nervous system can be divided into the somatic nervous system, which controls voluntary movement of our skeletal muscles, and the autonomic nervous system, which controls the involuntary movement of the smooth muscles and glands of our organs. This system is then further divided into the sympathetic and parasympathetic nervous systems. Now, the autonomic nervous system is made up of a relay that includes two neurons. We'll focus on just the sympathetic nervous system. Signals for the autonomic nervous system start in the hypothalamus, at the base of the brain. Hypothalamic neurons have really long axons that carry signals all the way down to the thoracic and lumbar spinal cord nuclei, where they synapse with preganglionic neuron cell bodies. From there, the signal goes from the preganglionic neurons down its relatively short axon, exits the spinal cord, and reaches the nearby sympathetic ganglion, which is made up of lots of postganglionic neuron cell bodies. The postganglionic neurons are also called adrenergic neurons because they release the neurotransmitter norepinephrine, which is also called noradrenaline, and to a much lesser degree, epinephrine, also known as adrenaline. These two catecholamines activate the adrenergic receptors on many different organs, which allows the sympathetic nervous system to trigger the fight-or-flight response that increases the heart rate and blood pressure, as well as slowing down digestion. This response maximizes blood flow to the muscles in the brain and can help you either run away from a threat or fight it, which is why it's called the fight-or-flight response. Now, there are two main groups of adrenergic receptors, the alpha receptors and beta receptors. Let's focus on beta receptors, which have two main subtypes, beta 1 and beta 2. Beta 1 adrenergic receptors are mainly located in the heart, where they increase the heart rate and contractility, which helps pump out more blood. Beta 1 receptors are also found in the kidney, where they stimulate a very special kind of cell called juxtaglomerular cells to release renin. Renin is part of the renin-angiotensin-aldosterone system, which increases sodium and water retention by the kidneys and helps increase blood pressure. Moving on to beta 2 adrenergic receptors, these are found on smooth muscle cells in the walls of blood vessels supplying skeletal muscles and the brain, which leads to vasodilation and increased blood flow to these tissues. In the lungs, beta 2 adrenergic receptors cause bronchodilation, and that increases oxygen delivery to cells. In the gastrointestinal tract, they decrease motility and slow digestion. In the eyes, they act on the ciliary body to promote the secretion of aqueous humor, which provides support and helps maintain the shape of the eye. Now in the liver, they cause more glucose to be released into the blood, and in the pancreatic islets of Langerhans, they promote the release of glucagon, which again helps raise blood glucose levels. Finally, beta 2 receptors stimulate an enzyme found on the surface of the cells lining the capillary walls called lipoprotein lipase, which breaks down triglycerides into free fatty acids and cholesterol. Alright, so medications that act on peripheral postsynaptic adrenergic neurons to block adrenergic receptors are called peripheral postsynaptic anti-adrenergics. And based on the types of receptors they block, they're divided into two main categories, alpha blockers and beta blockers. Now, beta blockers are subdivided into three generations. The first generation of beta blockers are non-selective blockers, meaning they work as antagonists on both beta 1 and beta 2 adrenergic receptors. So here we have propranolol, timolol, nadolol, sotalol, and pindolol. Actually, pindolol is not a pure antagonist, but a partial agonist. That means that when bound to a beta receptor, it very weakly stimulates it, but at the same time, it prevents binding and stimulation by the more potent catecholamines. This is known as intrinsic sympathomimetic effect. Or more simply, pindolol has the same but weaker effects compared to the other first-generation beta blockers. Now, by blocking beta 1 receptors in the heart, these medications decrease the heart rate and contractility, which lets the heart work less hard and pump less blood out, resulting in a drop in its oxygen and energy demands, as well as a drop in blood pressure. At the same time, beta 1 blockade in the juxtaglomerular cells in the kidney decreases renin release, which in turn decreases angiotensin II and aldosterone, letting more sodium and water be lost in the urine and lowering blood pressure even more. Okay, but by blocking beta-2 receptors as well, they also cause some vasoconstriction of blood vessels supplying the skeletal muscles and the brain. This is typically very mild though, and doesn't have significant effects on blood pressure. In the brain, in fact, beta-2 receptors in blood vessels are only reached by propranolol, which is lipid-soluble enough to penetrate the blood-brain barrier and induce some degree of vasoconstriction. Now, moving on to the lungs. Blocking beta-2 receptors causes bronchoconstriction, or narrowing of the respiratory airways, which obstructs airflow and lets in less oxygen. In the gastrointestinal tract, beta-2 blockade speeds up motility. In the eye, aqueous humor production decreases, so intraocular pressure, or the pressure within the eye, falls. Now in the liver, less glucose gets released in the bloodstream, and the pancreas releases less glucagon. So this results in a diminished blood glucose level. And finally, inhibition of lipoprotein lipase leads to the accumulation of triglycerides in the blood. Alright, so looking at the indications of non-selective beta blockers, they are widely used in the treatment of hypertension and coronary artery disease in the form of angina pectoris or a heart attack. It has also been suggested that beta blockers slow down the progression of congestive heart failure, or CHF for short. This remains controversial though, since individuals with heart failure often rely on sympathetic drive to maintain some degree of heart function. So in this situation, beta blockers might actually make things worse, especially in a situation of acute CHF exacerbation. Next, beta blockers can be used to slow down the heart rate in cases of severe tachycardia, like in thyroid storm, which is an acute, life-threatening complication of hyperthyroidism, where the body becomes very sensitive to the effects of excess thyroid hormone. For the same reason, some people use them in case of severe anxiety, like before giving a speech. Now, propranolol in particular has also been shown to effectively prevent migraines, a type of terrible headache, perhaps by altering the blood flow to the brain. And timolol helps reduce intraocular pressure when applied topically on the eye, which is why it's been used in the treatment of glaucoma. Now, side effects of non-selective beta blockers include bradycardia and hypotension, meaning that the heart rate or blood pressure may fall too low. Note also that in cases where someone quits taking them all of a sudden, they can lead to severe rebound tachycardia, hypertension, or even arrhythmias, meaning irregular heartbeat. There are also often complaints of fatigue, perhaps due to the reduced blood flow to the muscles, as well as dizziness, depression, insomnia, and nightmares, particularly due to the central nervous system effects of propranolol. Since they can cause wheezing, shortness of breath, and chest tightness, they are also strictly contraindicated in both chronic obstructive pulmonary disease, or COPD for short, and asthma. Sometimes diarrhea has also been seen. In other cases, there's hypertriglyceridemia, or increased blood triglycerides, and hypoglycemia, or reduced blood glucose levels. Hypoglycemia is the side effect to watch out for, as it may go unnoticed, since beta blockers blunts the counter-regulatory effects and symptoms of catecholamines, like tachycardia and tremors. That's particularly dangerous for people with diabetes who already take a bunch of other hypoglycemic medications, like insulin. Okay, now the second generation of beta blockers are selective for beta-1 adrenergic receptors, which is why they're called beta-1 selective or cardioselective beta blockers. Examples here include atenolol, metoprolol, bisoprolol, esmolol, and acebutolol. Like pindolol, acebutolol is a partial beta-1 receptor agonist with an intrinsic sympathomimetic activity and weaker beta-1 blocking effects. Now, once again, by blocking beta-1 receptors, these medications lower blood pressure by decreasing the heart rate and contractility, while in the kidneys they decrease renin release. This makes them suitable for the treatment of hypertension, coronary artery disease, and cases of severe tachycardia, like thyroid storm and anxiety. Their use in congestive heart failure is controversial here too, but metoprolol and bisoprolol have shown fairly good results, so they're commonly administered. Due to the absence of the beta-2 blockade, they don't cause bronchoconstriction, so they can be safely used in individuals with COPD and asthma. They don't affect blood glucose as much, so they are the preferred beta blockers for those with diabetes. Bear in mind, though, that at high enough doses, these medications may also start blocking beta-2 receptors, so these individuals should always be carefully monitored. Finally, we have a third generation of beta blockers, which includes labetalol and carvedilol. What sets this generation apart is that except for blocking beta-1 receptors, these medications also block alpha-1 receptors in the blood vessels, which normally cause vasoconstriction. This makes them particularly useful in the treatment of hypertension, where vasoconstriction is a problem, like those with peripheral vascular disease. Labetalol in particular is the most commonly used medication for the treatment of chronic hypertension in pregnancy, and it's also often administered intravenously in hypertensive emergency, when the blood pressure becomes really high really fast, and there's also signs of end organ damage like the brain and kidneys. Carvedilol also has antioxidant properties, meaning that it decreases the production of free radicals and prevents thickening of blood vessel walls, which is beneficial in the treatment of heart failure. However, both labetalol and carvedilol have side effects of alpha blockade, like orthostatic hypotension, where there's a sudden blood pressure drop when the individual goes abruptly from lying down or sitting to standing up. Now, we want to make a simple and fun mnemonic that'll help you efficiently memorize and retain all these farm facts. Okay, since beta blockers end in lol, let's put them in the LOL comedy club. Let's set up 3 stages for the 3 generations. All the stages are decorated with little hearts with knives stabbing into them to represent coronary artery disease like heart attack. The stages all have microphones with blood pressure cuffs wrapped around them for hypertension. Okay, so the first stage is labeled beta 1 and 2 for the receptors targeted by the first generation beta blockers. On this stage we have propranolol, timolol, nadolol, sotalol, and pindolol. So let's have a skit about a man named Tim for timolol, who's drinking a soda for sotalol. He's trying to fill his propane grill representing propranolol, but it's not going well. Frustrated, he pulls the pin on a grenade for pindolol and nadolol and decides to blow the whole thing up. Now, for drug-specific indications, Tim's so angry that his eyes are popping out, which represents increased intraocular pressure and glaucoma. On the propane grill is a mannequin head with a band-aid on it, since propranolol can be used to treat migraines. Okay, on the second stage we have the second generation beta blockers, labeled beta 1. Here we have an Eskimo performer for esmolol. His trick is that he can eat anything, for atenolol, and on his plate in front of him there's a metal handcuff for metoprolol, a piece of bismuth for bisoprolol, and an ace of hearts for acebutolol. His assistant is an obese man with diabetes, and he's here to remind you that second generation beta blockers are less likely to cause hypoglycemia and diabetes. Finally, there's an angry police officer on the stage who's missing his handcuffs. He's so upset that he needs to use his asthma inhaler. This will help you remember that second-generation beta blockers can be used in people with COPD and asthma, since they don't cause bronchoconstriction. Between stage 1 and 2, let's put some disorders that can be treated by both groups of medications. So let's have a tornado with little bow ties in it to represent thyroid storm. The stagehand is watching it anxiously to represent anxiety. Okay, moving on to the final stage labeled beta 1 and alpha 1, we have the third generation beta blockers. On this stage is a doctor in a lab coat for labetalol, and she's doing ventriloquism with a cadaver for carvedilol. The club owner is trying to wash away the smell with a hose that's shooting out red-colored water, to help you remember that these are the only beta blockers that cause vasodilation, and they can be used to treat peripheral vascular disease. For drug-specific indications, the scientist is pregnant to help you remember it's the drug of choice to treat hypertension during pregnancy. Her lab coat has ER on it to help you remember it can be used during hypertensive crisis. Now, for side effects, let's use the audience in front of each stage. By stage 1, we have 2 tables labeled beta 1 and beta 2. At the beta 1 table, we have a frozen heart representing bradycardia, and a man who stood up too quickly and becomes dizzy, representing hypotension. At the beta 2 table, we have a giraffe with a neck brace to represent bronchoconstriction, and there's a bunch of empty candy wrappers to represent hypoglycemia. Now at stage 2, there's only a beta 1 table, since these medications are selective for that specific receptor. Finally, at stage 3, we have the beta 1 table and also an alpha 1 table. The man at this table also stood up too fast and is feeling dizzy. This will help you remember that both alpha 1 and beta 1 blockage can lead to hypotension. Alright, as a quick recap, beta blockers are divided into 3 generations. The first generation are non-selective beta 1 and beta 2 blockers, which include propranolol, timolol, nadolol, sotalol, and pindolol. The second generation are selective beta 1 or cardioselective beta blockers, including atenolol, metoprolol, bisoprolol, esmolol, and acebutolol. Both first and second generation medications are used in the treatment of hypertension, coronary artery disease, and cases of severe tachycardia, like thyroid storm and anxiety. What sets them apart mainly are their side effects, since they may both cause hypotension, bradycardia, rebound tachycardia, and arrhythmias. But only the first generation causes skeletal muscle and brain vasoconstriction, bronchoconstriction, hypoglycemia, and hypertriglyceridemia. Finally, the third generation includes beta-1 and alpha-1 receptor blockers, like labetalol and carvedilol. But wait, there's more! Here's a mind map with all the mnemonics. Go ahead and pause the video so you can test yourself to see what you remember. Stay tuned for the answers after the credits.